Good afternoon, everyone. Welcome to the BHA Tech and Data Provider Office Hours. Just as a brief orientation, we are going to record this meeting for anyone who couldn't make it. And I will be your host today, but we have lots of exciting speakers to talk to you about all things tech and data at BHA. So first, I wanted to just give an overview of what the Tech and Data Provider Office Hours are and what they are intended to do. So BHA Tech and Data Office Hours is a meeting hosted by us, the technology and data team for behavioral health organizations and providers who use BHA's digital tools, pardon me. This is for you all to receive updates on changes and improvements to BHA, technology and data systems and related processes. We want you to have a space to surface and discuss tech and data related questions with our team. That way we understand the impacts of the things that we're doing, whether that's good, bad, or indifferent. And we would really like to open up lines of communication with you as providers because it's our job to help you. We want to have you provide feedback and expertise to our ongoing tech and data efforts. So this is a place where you might hear about opportunities to test our digital tools, to provide feedback on our digital tools, to contribute to the customer experience studies that go on with our various tools. It's also a place where you can tell us that things are causing downstream administrative burden that maybe was not expected, and a place for you to understand opportunities where you can further engage with BHA's tech and data team. If you are contracted with a BOSO and you are here, this is a great place for you to be. But questions about Unity or compliance with your BOSO contract are things that we're going to redirect back to your BOSOs. They also hold their own tech and data connection points with providers. And if you aren't aware of those and you're contracted with a provider, we can help you get involved. Moving on to our agenda for today, we're going to give a TaDa division overview and introductions. We're going to have some topics around TaDa's digital portfolio. We're going to have an overview of the CoBHRM, which is the new data model that replaces CCAR and DACODS. We will have updates on the TMS launch and timeline, and we'll have time for questions and discussion. So, who is our speaker for the Tech and Data Division overview?
That would be me. Thank you, Gwen.
I'm going to pass to Marquet Green. And Marquet, could you briefly introduce yourself to this group?
Yes, I can.
All right.
Good afternoon, everybody, and thank you again for taking some time to come to this Tech and Data Office Hours, and also thank you for everything you do for our citizens in the state. The work that you are doing out in the communities is making an impact every day, and we just cannot thank you for all of the effort you put into that. So my name is Marquet Green. I am the Division Director of the Technology and Data Division. I've been with the BHA for a little over a year and really excited to be here with you all today. As this is kind of the first time we're doing provider office hours in a while, I thought it would be good to do a bit of an overview on what the Tech and Data Division, also known as TaDa, is focused on and who we are. So TaDa is made up of data scientists, evaluators, infrastructure experts, product managers, engineers, user experience researchers and designers, and customer service advocates. And what we're really focused on is four main things: leading BHA's data sharing and technical collaboration with external partners, vendors, and cross-agency systems, really to make sure that we have visibility into the behavioral health ecosystem across the entire state. The next one is delivering insights through analytics, modeling, and evaluation to inform BHA programs and policy decisions, really making sure that we are making that data accessible and really speaking to the story of behavioral health And a lot of those insights are made available on BHA's Performance Hub. The third one is building and maintaining the infrastructure, pipelines, and platforms that power secure, reliable data workflows. Really making sure we're building out, for lack of better words, the plumbing to get the data in our environment. And finally, last but not least, would be ensuring BHA's digital products are user-centered, well-supported, and effectively adopted by customers and stakeholders. So just know that we are very, very interested in hearing from you all on how we can make our digital tools better. If we can move to the next slide, please. Thank you. So just want to give a quick overview on our leadership team. So I mentioned myself, I am the division director. Then we have Troy Evett, who's on the call. He is our data systems and operations lead. Gwen Gauman, who is emceeing, is our interoperability and strategic partnership lead. We are currently in the process of backfilling our product and customer success lead and our data science and evaluation lead. And then a few honorable mentions on the leadership team would be Karen Liu and Ryan Blair, who serve on our product and tech lead teams. All right. Now I thought it would be good to get a bit of an overview of TaDa's digital portfolio. We could move to the next slide. Perfect. So today's conversation, we're really going to focus on the tech and data digital portfolio. So, hopefully all of these tools are tools you are familiar with, but we have things like TMS, treatment management system. We have CCAR, which was our assessment and discharge for mental health records. We have Ladders, which is our licensing and designation tool. We have Client Care Search, which is inpatient and residential bed availability. Central Registry, which is our opioid treatment program admission and discharge. OwnPath Profile, where providers go in and update their information that is then made available on OwnPath Care Directory. So these are the scope of products under TaDa's purview, and definitely excited to kind of hear more from you all in this space. So if we move to the next slide, I think we have a poll from Gwen.
Bianca is going to help me out with the poll. And where will folks be seeing this come up?
Just
so
as like
everyone should see a pop-up window at this point. And you'll have a chance to vote on what you want to learn more about from the technology and data team. We're still getting a lot of responses right now, so I'm just watching the numbers tick up. Okay, so it looks like we're slowing down a little bit. So first in line for everyone here is wanting to learn more about TMS and CoBHRM. So that's awesome because that is one of our next topics that we're planning on discussing today. Second, with 25% of people wanting to learn more about Ladders, our licensing and designation tracking system. And then that is followed by Central Registry, then Client Care Search, then CCAR. Also, data science is one of our winners. And then everybody else, all of the other options are single digits today. So why don't we will keep track of this, and it will help us form what we present out to you each week, folks. So thank you so much for participating in the poll. And I'm going to move to the next slide. Now we have a poll about what area best describes your role. It looks like we have got quite a few responses to this poll. It looks like our winner under these categories is admin and operations. That is followed by management, then followed by clinical. Next is data, next is quality. And then in a tie, we have IT and other. Thanks for participating. It's really helpful for us to know who is here with us and what capacity you operate in your organization. And now I would like to transition to our really popular topic today. So the Colorado Behavioral Health Reporting Model, or CoBHRM overview. And for that explanation, I am going to pass to Troy Evatt, who is now on screen with a beautiful picture of the earth behind him.
Thank you, Grant. Good afternoon, everybody. Sounds like the CoBHRM is front and center of everybody's attention these days, so let's do a little background. So we have launched the new Colorado Behavioral Health Reporting Model. That's why you see the abbreviation, the CoBHRM. And essentially what this is that we are finally getting rid of the day codes and the CCAR, and we are combining them into one data entry system. You guys know all too well that the majority of our clients have some sort of co-occurring or dual diagnosed condition. So many times when a client would come into our centers, they would have to do both a CCAR and a day codes. That was a lot of burden for everybody. So we have eliminated the dual nature of that and came up with one model, the CoBHRM. Next slide, please. So many of you were probably involved in a lot of the studying we did. We have been really focused on a user-centered approach to what were the problems with our old system. And these are a couple of examples. Spending several hours a week filling out forms. One of the other things we heard was we have to collect demographics in different ways that don't match. And finally, no administrative support for the smaller companies here, where the burden had to fall on the clinicians and the staff. We listened to all of this feedback, and this is what launched the idea for the CoBHRM. Next slide. So why does the CoBHRM matter at all? Well, first and foremost, the federal block grant funds a lot of our behavioral health programs here in the state of Colorado. We have been reporting all of this data back to the feds for decades. Our state has always been compliant, and I believe it always positions us in a good place for various grants outside of the block grants, as we have shown the ability to be compliant with all of the federal requirements. The other thing, and Mark Hay touched on this briefly, is really understanding the ecosystem in Colorado, making sure that everybody that receives behavioral health services in Colorado gets the best care possible, and then telling that story to our governor's office, telling that story to the legislation, telling that story to the media, so that we can highlight all the great work you guys are doing out in the community. Next slide.
Roy, we do have a question in chat, so just let me know when you're ready for those questions.
I can take them as they come in, Gwen, if it looks like something relevant.
It definitely does. So this one is from Walter Mondock. And the question is, can you speak to if we will get a new portal or if we are doing a back-end EHR export to CSV format and submitting?
Sure. Great question, Walker. So at the moment, we have a kind of brand new old portal. So we have modified the TMS system, the treatment management system, where people used to fill out their day codes. We have modified it to accept the CoBHRM It is a web-based data entry form. If you've ever filled out the day codes in TMS, it'll look very familiar. Just a few more bells and whistles, a few new fields. As far as back-end EHR exports, at the moment, we do not have the capability of accepting that data in a batch format, but that is one of the first phases of updates that we'll be doing in the system. We have recently purchased and implemented a data lakehouse that does accept these records in a more modern way. So stay tuned after this initial launch for updates. We will be looking to do more exporting out of EHR. And when we do these batches and APIs and all of this, we're also looking and working very hard. Ryan Blair's on the call to put these records into a format that EHRs can easily use. So we are looking to make the back end FHIR compatible. So it should be very easy for your EHR to talk with our back-end data system in the future. Now, the CoBHRM has a few goals. One of those, of course, is to reduce administrative burden. But the other thing that we've heard loud and clear over the years is we need to be more episodic as opposed to just collecting encounter after encounter and after encounter and then trying to piece it all together. So you'll notice with the CoBHRM, it's all very client-centric as opposed to the old TMS and the day codes and CCAR that were very encounter-driven. That will give us a better look at how a client proceeds across their episode of care and make less data entry a thing. Also, we've talked about this a ton. We really wanted to get rid of that redundant data entry of having to do a CCAR, having to do a day codes, having to do multiple admissions and discharges within each. This will help reduce that redundant. And there was a lot of outdated data collection that was being done, including the CCAR assessment itself, an assessment that hasn't really been used by many for several years. So we weeded out all of the different fields that we no longer felt were current and took all the redundancy out of the system. I think you'll really like the new streamlined version. And finally, we want to make sure that we are tracking people in a better way so that we can begin addressing not just behavioral health needs, but the whole health of the client. As many of us know, there's a big tie-in to a person's housing situation or medical situation as well. Being able to identify clients and track them across, making sure they're getting that great continuity of care. There's the word today. Making sure that people are getting the care they need. All right,
oh gosh, we lost our slideshow. My apologies. Hang on one second while I correct that.
No problems. And as Gwen's pulling back the slides, Ryan has put that draft FHIR implementation guide. So if you are interested in having your electronic health record system use a FHIR output, this is our initial implementation guide. Check it out. It's a wonderful resource and a way to communicate back to us your thoughts on FHIR.
Still working on it. Soon.
No problems. I'll take one from Andrea while you're pulling that up, Gwen.
Sounds great. Thank you.
Andrea says, what is the portal link for the CoBHRM and will our current logins carry over to it? Okay, so if you were previously a TMS user and entered day codes in the system, your current login will be still valid. You'll sign in just like you always did. And the only difference is when you go into the system, it's going to look like the CoBHRM as opposed to the day codes. If, however, you are a CCAR user, you will need to transfer your credentials over to the day codes. And there will be a slide here in a minute that will tell you how to get a hold of our help desk support, and they can help you with that. All right, so how did we get here? But we talked a lot about reducing burden, but we also talked about human-centered design and making sure the providers were with us all the way. So we've had a lot of going out into the communities, talking through users. Many of you probably were asked questions about the old day codes CCAR, what you would like to see. So we talked to over 16 provider organizations. We talked to rural, we talked to urban, we talked to mental health, we talked to behavioral health, DUI, the works. So we looked at a lot of different settings, and we updated this to this current model. One thing I think that everybody can celebrate is if you used to do the day codes in the CCAR combined, that was over 213 data elements. Now we've reduced that to, depending on what the needs of the client are, to around 80. So that is a 60% reduction in data elements that need to be recorded. The other thing is just the redundancy of that data, having to do updates and whatnot. I think you'll see moving forward that even that reduction is going to improve exponentially as the clients go through their care. Next slide. Okay, so what has changed? Well, again, if you're a TMS user, you're probably used to seeing the day codes of the detox, the DRS, and the ads codes. Well, the day codes and detox tabs are no longer available. Now you will see a CoBHRM tab in its place. CCAR has, if you are a CCAR user, you probably know by now, we're no longer accepting CCAR records as of July 1st. Those are, again, will have to be entered into the new TMS system in the new CoBHRM model. Any records that you have opened in day codes currently will be converted to the CoBHRM. So if when you last left your record, it was an open day codes admission. When you come back into the system, it'll be an open CoBHRM record. Again, with the CCAR, you will have to start fresh with that. But if you have a day codes record, it is ready for you to go as soon as we turn on the portal. And many of you, of course, have been through the fact that the DUI providers have moved over to TMS as well. So many of you might have been putting DUI information into Unity. Now you'll be putting all of your information into TMS. The good news again there is if you were putting your records into TMS or Unity, when you go back in the system, there should be a CoBHRM record waiting for you to update. So what hasn't changed? Well, we still need to have mental health data for our block grant. We still need to have SUD for our block grant. We still need to have crisis information. So all of the data itself is still in there. It's just been put into one streamline. The other is the type of demographic and outcome data being collected. Many of the fields that you were used to seeing on the TMS or the CCAR are still in place because those are the fields, demographic and outcome data that we store for the feds. And finally, if you are someone who submits 837 encounter data and have done that in the past through the CCAR system, you'll continue to do that. We are no longer accepting CCARs, but we still will accept encounters through the CCAR system. All right, next slide.
There are a couple questions in chat. One of them is about when the new model goes live for OTP. We have several questions about launch dates, which I think we'll get to in a moment. And then we have one, can we get an outline for the fields of the new system, which I do believe we have, and we can link here.
Yes. If someone on the call can put a link into our documentation, that would be fantastic. And I will address the elephant in the room. When are we launching? So next slide, I think we'll answer a lot of questions. Okay, so let's start with the CCAR. Okay, so we had previously in meetings said if you had a CCAR that a client that was doing mental health care and you had an open CCAR and you were no longer seeing that client, we were wanting that CCAR record to be discharged on or after 7/1/2024. Obviously, that date has come and gone. So at this point, if you have an open CCAR record, you need to either, if you are a now part of the BHA network, you will have to go in and create a new CoBHRM record in Unity. If you are not part of, if the mental health care is not being contracted through the BHA, you'll have to go into the TMS and start a brand new admission record with all the information that was on the CCAR previously. As far as all the open CCAR records that were in the system, all of those have now been administratively discharged by the BHA. Now you'll notice that if you send us a brand new admission with the information that existed on the previous CCAR, we will do our best to match that up in the background so we keep that continuity of care. So you'll notice here, for if you submit that record, if you could continue to put in that EHR client number that you had and that original admission date, that would be very helpful for our data science team. Before we move on, former CCAR users, any questions about the CCAR? Okay.
So anything that was open has been discharged, and we need to duplicate those in the new system.
Yes, a brand new CoBHRM record needs to be put into TMS or Unity. I know we have some people that do a little bit of both. So even though this isn't technically for the Unity folks, we know that there's a back and forth there, especially with like different types of record types of services that they're contracted for. But yes, brand new records on those. Now the day codes data conversion is a little bit smoother because we're still using the TMS system. So if you had an open day codes record before, when you come back into the system, you'll have a CoBHRM record that will look very similar to the day codes record that you left us with. The only thing that'll have to happen is that you'll have to update a few fields prior to discharging it just to make it CoBHRM compatible. Right now, once again, we have shut down, many of you have figured this out, we have shut down the TMS system as of July 1st. We are in the midst of converting all of those open admission records to CoBHRM records, and that should be available to you around August 15th. When you come in August 15th, voila, you will see all your open admissions in there looking like a CoBHRMs. And then from that point forward, any future updates that you would make to that record or discharges will be done in the new TMS CoBHRM module. Next slide, please.
Roy, I already moved to it, so we're on the day codes data conversion slide now.
Yeah, we just got through talking about the day codes being it's a straight update. We're converting them as we speak. We have a wonderful team of IT people that are converting all your records so that when you come in, it should be smooth. If we had DOI day codes in Unity, I have a question from Leanne that's pretty timely. If we had a DOI day codes in Unity, would those transfer into TMS CoBHRM? That has happened. Signal has sent us. Rocky has sent us. The Bossos have sent us all of those DOI day codes. So again, when you come back in the system on August 15th, you should see all of your open DOI day codes in there. Again, they will be in the new CoBHRM model. So there's just a couple of updates you'll have to make and off to running for updates and discharges. Oh, yeah, and as we move to that slide. So again, we had a cutoff way back May 31st. So that's already happened. You had to have put your data to Signal by May 31st for them to move it over to us. Anything after that, you should have been putting into TMS starting June 1st. And again, we shut down the system at the end of June, 1st of July. So when we come back on August 15th, the data should be right where you left it, only nicely converted for you. Once again, if for whatever reason you have not got your user ID and passwords, the link to our provider help desk, Mike and Melissa, very helpful. They will help get you all set up in TMS with a brand new user ID and password.
So Troy, my apologies, I accidentally advanced the slide, but we do have a question that is relevant to what we're talking about now.
Sure.
So this one's from Rodney Babcock. When I add a new client into TMS, I also add them into DACODS, since DACODS is not available, I will never be able to be back in CoBHRM and enter them on August 15th. Maybe you want to read this one in chat?
Sure. Great question, Rodney. So when you add a new client into TMS in the DACODE system, I'm guessing this is for a DOI, you would also put them into the DACODES. So at the moment, as you've noted, the DACODES is not available. But on August 15th, the CoBHRM will be available. So yes, you'll just enter them in on August 15th. And as you can see from the slide, we're going to give you some time. We know that the system's been down for a couple of weeks, so we'll give you plenty of time to enter all that data that's been stacking up over the next 6 weeks.
Okay. And then we do have another confirmation from Emily Osan. It says, just to confirm, if there was an open CCAR for FY26, those were administratively discharged. And anyone we're continuing to serve in FY27, we will be adding a CoBHRM for them at or after August 15th. Is that correct?
You know, Emily, you should be writing my slides. That is perfectly stated.
All right. Are we ready for the next slide then, Troy?
So the question also goes on and says, we don't need to be submitting any discharge CCARs for fiscal year 26 because they were already administratively discharged. That is correct. However, what we would like, again, for you to do on that, Emily, is when you submit that new admission, right? If you give us the old client ID that used to be on the CCAR and that original admission date, we can tie them in. We'll take the CCAR that was previously administratively discharged, we'll reopen it, so then all those records will flow together. That will give our data science team a much better picture of that client. So at the very worst, if we can't match them up, we say, oh, brand new client. If we can match them up with the information you put on the CoBHRM, we can actually open up all of that past history as well. So perfect question, Emily. All right, next slide.
We do have one more question that came in from Kate. I will butcher the last name, but I'm going to go ahead and read it. It says, I am noticing that the options for sex assigned at birth do not include intersex or unknown or decline to answer responses. Will this be updated, or can we anticipate that the choices will be strictly binary?
Great question, Kate. As you know, the administration at the federal level has made sex at birth a binary option at this moment. So we will be capturing sex at birth as a strictly binary option moving forward. There will be options for gender to go along with that information. Marquet, would you like to jump in here as well?
Yeah, just to reiterate what Troy said, a lot of this reporting for CoBHRM is leveraged for SAMHSA reporting, and we just have to ebb and flow with this administration to assure that we are not putting any funding in jeopardy. So just want to make sure I highlight that as well.
Totally hear that. I think we're preparing to have to prep our clients for some of the stuff that I don't think anybody, it's not a personal thing, obviously. Would there be an option to choose a decline on that? If we can't include an intersex and we have to be with the binary system, is there an option as with the others?
Yeah, at the moment, no. That is a required field, and it has the two options. Now, as legislation or administrations change, keep an eye out. We're always, the beauty of having all of this in more adaptable way is we can make changes as changes are necessary. So, but for now, it is required, and it is just the two options. Thank you for your question, Kate. That comes up quite a bit. All right. So to kind of get kind of a summary here. So prior to 8/15, number one thing, make sure you get a TMS user ID and a password so you're all ready to go when the big day occurs. And then for the moment, just hold on to that data. When the website is ready, we'll wave the checkered flag, and you can go in there and start putting in all of that new data. And again, this will replace no longer required to do a CCAR or a DACO. Those forms have been officially retired. Those are no longer acceptable. And I just want to point out at the very bottom here, we would like to get that data in. You have until October 30th. We know because the system's been unavailable for a few weeks. We wanted to make sure we give you plenty of time to get your data in. We picked October 30th because that is when we would be reporting the first quarter data. So we'd love to have it in there. If for whatever reason that is causing some sort of hardship, please reach out to us. Let us know that, due to staffing issues or whatever the case may be, being down for a few weeks, that 1030 is just unrealistic with the volume of clients that you have, and we'll work with you. We want to just keep reiterating because I think people get nervous, right? We know what a big shift this is. We're all like, you you only do things like this once every couple of decades. So we expect it to be some bumps. We expect there to be lots of questions. There might be some issues. We're here. That's why we're setting up these meetings. We're here as a partner. This is not some sort of, if the data's not perfect on the first day that we open up the system, there's going to be the hammer coming down. None of that. We're all in this together. We want to make the information, we want to make the ecosystem here in Colorado great. We want to make sure people are getting good care. That's why we're doing this, not to some sort of gotcha exercise. So please don't be nervous. We know that there's going to be issues. We're here to help you and assist you. If you're struggling, don't struggle in isolation. Reach out to the BHA. Reach out to Signal if you're a Unity provider. We're here to help you, not to dictate to you, as it were. Next slide, Gwen. Once again, can't reiterate enough, we have a help desk as we move forward. I'm sure there's going to be lots of questions, lots of things happening. Melissa and Mike are the friendly people on the end of that line that will be helping you. But me and Sharon Pollock and others, we're all sitting there waiting as well to assist as we move forward. Someone was asking a little bit about the data fields on the CoBHRM. There's also a link here. You'll see official BHA CoBHRM documentation. Really good stuff. Ryan Blair put that together for us. And everything you ever wanted to know about the CoBHRM, but we're afraid to ask, is in there. But again, if there's something we're missing, let us know. We'll be glad to update that information and get you answers.
Troy, I just wanted to highlight that Heather Dolan from Signal is saying that anyone who's partnered with BUSOs can email support@signalbhn.org.
Perfect. I know that I've had to use Signal's help desk before for some password stuff, and they are also extremely helpful. So you're in good hands there as well.
Okay, and I will move to the next slide. So here we are at questions and discussion. So now I just want to open the field to anyone on the call that has other questions that weren't covered here underneath our topics for the technology and data team. And if you don't want to come off of mute and ask by voice, you can always chat any questions that you have. Okay, we have a question about TMS logins here in the chat. Troy, logistic questions on TMS logins. Each provider will get their own login. Is that correct? We won't have one just for our organization.
Yeah, so currently TMS was built on the premise of every site being its own individual location. So every site has to have a unique password and ID. So if you have several locations around, each site needs a password to enter that information. Because if you'll notice when you come into the day codes, it always, as a security measure, always puts that license number in the day code. So it prevents anybody from being able to see across sites. One thing that I think is very exciting, we're working on a more flexible option where people can, through a password, request multiple sites within a provider. So be on the lookout for that. That's something our IT team is working very hard on because it will make it a lot more user friendly when someone can look across different agencies rather than having to log in and out to look at different sites. So keep an eye out for that. That should be something that comes in the next calendar year for sure.
Okay, and we have one more chatted question from Vicky Cabrera. The question is, to confirm, the input of day codes is still going to be that form, just more in-depth, ? Or will it be a CSV upload?
Great question, Vicki. But the one thing I'll say is we can't use that bad word anymore. Day codes is no longer. So we got to get used to that. Yes, the CoBHRM is at the moment a input into a web portal only. The CSV, Ryan provided some great stuff on Fire for APIs down the road, but also we're working with Signal right now on a CSV upload. Once we get that perfected with them, we will be opening that up to other agencies as well. So yes, keep an eye out. We know that it's not always ideal to go into a web form and type in that information. So we will be looking for some more user-friendly, less burdensome options in the months to come.
Great. And then an important question from Anna Long as well. So if behind on DACODS submissions and DACODS is now closed, is it the best step to just begin entering those to CoBHRM, even if it's from a while ago, like a month or more?
Yeah, so if you have a DACODS that you haven't submitted an admission for, you will need to do a CoBHRM admission for all of those open records. If you had previously submitted an admission DACODS, those will be converted automatically for you into the CoBHRM, and you'll just have to do an update and a discharge at the appropriate time.
Okay. I see some questions now about how we're going to access recording after the fact. I would like to get to that one after just a further follow-on question about CoBHRM, and we'll come back to you, Chase. So this one is from Nicole Worth, Troy. With the CSV, you could input multiple patients with the codes ? Rather than one-by-one entry like we have at the current moment ? So it's just clarification of what you just described.
Yeah, so I might be getting into more depth than you want on this one, Nicole, but if you look at the way the web system that we put together works, it is based on the old DACODS model of an admission and a discharge. So if you use the website, you will still have kind of an admission discharge type feel. Once the CSV is open to you, then it will follow more along the lines of the CoBHRM data model itself, where you'll send in one client record, but then you could submit multiple admission, diagnostic records, discharge records, etc. So it's a little bit different, but the CSV, when that's available to you, we'll make sure everybody has a copy of that model. And it is available. And if you want to look at that model, it is in the documentation out on the website. Much more modular than the single here's the client, here's the admission, here's everything in one big record. So it will be a little bit of a change, and I think it'll be a change that you'll really like.
Nicole is thanking you, Troy. And then we have another question from Tanya Rubio. Tanya says, for our clients who are temporarily going into detox, we do not discharge them. Now with this new reporting system, should we be looking into adjusting our process to meet the reporting needs? Yeah.
So, Tanya, if I don't answer your question, you can always do a follow-up. If you have a client, let's say an outpatient, who goes into detox, you do not need to discharge them out of outpatient. It is perfectly legitimate to have a client in several different types of behavioral health settings. So we would expect that the detox facility, the withdrawal management facility, would also be submitting an admission record for that client. But it should not affect, if you're expecting that client to come back into outpatient when they are discharged from withdrawal management, you should not have to discharge them and then reopen them.
Okay. And then one question from Anna Long, who is saying, Tanya also confirmed that you did answer her question. So Anna's question is there a deadline or time limit to when you can enter a client into CoBHRM? For example, if you're needing to enter a client from 5+ months ago, is this still acceptable?
Not only is it acceptable, we would really like to have that data, right? We want to have accurate data. So that's why we're giving everybody till October 30th to get all those past admissions in. It doesn't matter if it's 5 months old or 2 weeks old. We'd love to see that data. And if you're having any problem entering that data, let us know. But again, we want to have every open client receiving care in Colorado in the CoBHRM system. So yes, please submit that. And if October 30th is if you think you're going to have trouble meeting that date, please reach out to us and we can work out a plan to help you with that.
Okay, Troy. And then one more question from Walker, which is, when the CSV is available, will this negate having to use central registry? No, but I'm going to pass to Troy to explain why not.
Yeah, great question, Walker. No, the central registry, there's a couple of things about the central registry that are very important. The whole point of the central registry is to make sure people cannot be admitted into the same treatment across various sites. So that's why there's that online presence of the central registry, because when you go to admit someone, it's going to check through the system to make sure that person isn't receiving care somewhere else. So that is almost a separate entity. Now, down the road, there is going to be something that I'm really excited about, where we combine the central registry with the CoBHRM. So the information you're filling out in one place can help push into the CoBHRM. But no, the central registry is a federal mandate. It has to be like real time, and it has to be separate at the moment. But great question.
Great. Anna and Walker have both confirmed that you answered their questions, Troy.
Great.
I'm just going to pause for a second to see if there's anything else that needs clarification or any other questions that we have today.
And I just want to point out to everyone on this call, you might think of a question afterwards, or when you get into the CoBHRM, you go, oh, I wish I'd asked this question because I'm a little confused about something. Just because we're not in the meeting doesn't mean you can't ask questions. So we are constantly collecting questions through the help desk. They are getting them to us. And not only will you get timely answers to that, but we also post frequently asked questions as well. So if you think to yourself, oh, maybe no one else has answering that or needs to know that, odds are there's 3 other people going, man, I wish I knew the answer to this. So don't be shy. Like I said, this is a big change for all of us, and we want to make sure that you're not confused. Or, we just got to answering a question about someone who's in outpatient care, wondering if they have to do a discharge every time someone goes into withdrawal management. That's a lot of burden. if you think something doesn't make sense and you're putting in way too much information, holler at us. We can help you with all of that.
Great. And Marquet has popped in the email to provider support. Please send all of your questions there, and I have it up on the slide, but I'm going to go back and just see if we have any other questions we can answer right now. Okay. So at this point, here we go. One from Anna Long. If your agency has 2 locations, does this need to reflect in CoBHRM like it did in DACOBS?
Yes. The short answer to that, Anna, is yes. Every CoBHRM admission is going to have a license number on there. So now here's something that's in the works that we're working very hard right now with Signal on, is if you know what, I'm not going to get into all that confusion because it's not in place yet. I'll stick to a short answer on this one. Yes, currently, if someone is receiving care in an agency, we would need to have number 1, a password and ID for both locations, and 2, you would enter all of that data per site for the moment. And see, I wasn't going to do the complicated answer, Gwen, but then the very next question is going to talk about the complicated answer. So one of the things that we're working on, Kevin, is his question is, will it be easy to transfer a client from site to site, different license numbers? We are really, so our goal for right now is to eliminate all that redundant data and make it a lot more streamlined. Our goal for the coming year is to really make our data systems more episode friendly. And one of those is to make sure that when people are moving from different license numbers, we make it so easy for you. Now, at the moment, there's a couple of different things that we put in. Number 1, when you get to the CoBHRM, you will notice we have a brand new modality that talks about behavioral health outpatient. So if someone is receiving both mental health care and substance use care, you'll only have to do 1 admission. And that could be obviously across license numbers. Where we're working with Signal right now on a brand new solution would be that once you've admitted someone into that 1 center, then when you submit encounter data, you could put the location of various sites in there. So if a client is receiving care at 2 or 3 locations, that would be something you could indicate on the encounter versus the current clunky way of admitting and discharging people into different sites. So you should see lots of exciting updates over the next 12 months as we really move to that next stage of reducing administrative burden and being more encompassing of continuity of care by making it very easy to move back and forth. At the moment, if you're putting the CoBHRM into TMS, yes, if someone's moving from one agency to another, that does require a new admission. But we're making it better, Kevin. And Heather.
I apologize if I'm going to reiterate this because I think maybe you just answered it, but Andrea Buer has a question in chat. Does this 1 admission include a change in the level of care within a facility, such as from intensive outpatient to outpatient?
So on that situation, you would have to, you would have an admission, and then they would be discharged out of IOP, and then you would have a brand new admission into outpatient. And then obviously when they are done with outpatient, there would be a discharge. Once again, we're going to look at some different ways to reduce that burden and perhaps create a better way to transfer between levels of care. But at the moment, that is a separate admission and discharge, Andrea. And Heather had a quick question. Withdrawal management, every time someone comes into care at the moment, that is an admission and discharge for each withdrawal management. but we are also working on a way to maybe help that out with encounters as well. Look for that information in the next few months. Oh, sorry, that was a private message from Heather. So you probably didn't see that in the chat. Sorry about that, Heather. Yeah. So one of the things that, if you're familiar with the day codes, if you go into withdrawal management on a Wednesday, a Thursday, and a Friday, right now that's 3 separate admissions. What we're looking at is having that admission happen on a Wednesday, and then you would have encounters coming in Wednesday, Thursday, and Friday, so that we would know that there was 3 withdrawal management things happening, but they would be all represented under one admission, once again, to kind of reduce the burden. That's why I shouldn't be reading, like I got chats up, and I probably shouldn't be trying to multitask.
Okay, did you just cover Tanya's question? I'm going to read it out loud, and but she's just confirming. So I just want to confirm this is for levels of care, not adding additional services. For example, a client adding a med management component within our practice. So how would that be handled, Troy?
Yes. So if the person is, so when you get into the CoBHRM, there is different services that are indicated. What we used to call modalities, right? They're now called services. So if you see in that drop down, there's going to be different services. If someone moves from a service to another service, if you see them listed in that drop down box, that usually indicates, yep, we need to put a new admission in. If there's something that changes, so for instance, if someone enrolls into like a medicated assisted therapy, there's a brand new CoBHRM box that when you just check that box, you don't have to redo the admission. You just say, oh, we have added a component to this care, medication assisted therapy. We have brand new multi-select boxes for EBPs for different programs. If it's changing into enrolling into a program or a different evidence-based practice, that does not require a new admission. You just go in and update the existing admission with that new information. So as a rule of thumb, if it's in the service level drop down, it requires a new admission. If it's something that's listed as another option on the screen, does not require a new admission.
Great. So I think I really want to get to Chase's question, which was how to access the recordings after this meeting is done. The way that you'll be able to access those will be that all the attendees to this meeting and who are on our distribution list are going to receive the recording linked into an email, and we will also post it on our website. And Karen or Bianca, if we know what page that's going to be on right now, we could probably throw that in chat. But if we don't, we'll make all of that clear in our follow-up email. And I just want to say for the entire technology and data team, thank you all so much for coming today. Thank you for asking great questions. Every time you ask a question, it helps all the rest of the provider community learn. And we appreciate you being here, and we're looking forward to this connection with you every month. Have a nice day, everybody.